So I'm the manager for the Centre for Clinical Effectiveness at Monash Health, and we're a unit that supports evidence-informed decision-making. Today I'm going to talk to you about a process that we've been working on for the last 7 years and the involvement of choosing wisely in that process. So the process started with the creation of the Evidence Dissemination Service, and it started with the collection and assembly of all the evidence of highly synthesised data indicating clinical effectiveness, harm, lack of effect, or no effect. And we then disseminated this out. We didn't use any governance other than the governance around my centre, and we encouraged voluntary uptake of these recommendations or indeed evidence. We then soon realised that there's way too much of that kind of evidence being produced, even though it was at a synthesised level. We prioritised evidence to disseminate that was about harm and where there was no effect. We used a committee that was set up in the organisation. It had broad representation, however there was some limitations in terms of how much representation there were, and in that I mean that there were program directors involved, and there are a lot more other clinical leaders in the organisation that aren't necessarily on this committee. We did ask, when we disseminated the recommendations or indeed the evidence of harm or lack of effect, for a response. Although we did get some response, there was some limitations on that follow-up process. In 2012, the Choosing Wisely initiative began in the United States and indeed presented us with a very highly prioritised set of recommendations that had been developed using evidence-based approaches and indeed clinical engagement. We continued using the committee governance to disseminate and indeed request response from our clinicians about how we may respond in our practice according to these recommendations. We now are working on a space whereby we use our Australian Choosing Wisely recommendations, and we also incorporate others from the other jurisdictions, United States, Canada and Europe. We have now moved to disseminate these recommendations under clinical governance that comes from a council of clinicians that sit across the organisation and include quite a few more leaders. So it's this leadership group that actually send out or disseminate these recommendations, and also request from our clinical leaders from the floor a response about how these recommendations are indeed embedded in our practice, and if they are not, why not, and a process of feedback is then fed back to the clinicians about how these clinical leaders want things to either change or improve. And so this is a process that we're just rolling out at the moment. There are many lessons we've picked up along the way, and starting with the evidence and recommendations, the Choosing Wisely recommendations present a very highly prioritised way of compiling evidence of do not do or harmful or unnecessary tests. We learnt that organisational decision-making structures are important, and governance and oversight of both dissemination and monitoring of practices is important. We learnt that broad engagement across the organisation is also relevant and is an enabling factor in dissemination and indeed uptake into practice. And we now, with the new process, are establishing what I refer to as accountable leadership, in terms of clinical leaders are now needing to account for the way we may go about embedding these kinds of recommendations into practice. In terms of implementation, we've learnt that leadership is important as a driver to the culture and process of embedding and using Choosing Wisely recommendations. We learnt that you need to facilitate the process of dissemination and to also monitor the response and how we use them. And we've learnt that you need lots of resources to support the work that we're doing. I'm just going to go briefly over some of the work that Monash Health is doing to embed the recommendations from Choosing Wisely in our organisation. And I'm leading with a project that taps into the consumer engagement aspect of it and 5 questions to ask your clinician or your doctors. And this is a patient experience team leading this initiative. It's a co-designed project whereby we work with our doctors, we work with our consumers to develop a resource that can be used to encourage both our consumers to ask questions and indeed to enable our clinicians to be receptive to the process of discussing the tests that are going to be done. And we're starting the process off in the diagnostic imaging area. Other aspects, and I'm not going to go into the details of all of these today, but they generally our initiatives include aspects of training and embedding the Choosing Wisely recommendations into the content of our advanced training programs, and this happens from across the board and multidisciplinary, so medical, nursing, pharmacy and allied health. In particular, we're looking at the use of protein pump inhibitors, the re-evaluation of whether we need to continue using them once they've been administered. In particular here in the ICU, we're looking at the change of policy of our peripheral lining, the change of the peripheral lining catheter and the timing around that. And here is just a couple of other different initiatives that are underway at the moment at Monash Health. And I'd just like to acknowledge the people that have been involved across the last 7 years of work on this process and ongoing. So thank you.